welcome you to the second session for homeopathy for today. I'm going to be focusing on this session regarding the philosophies and principles of homeopathy and on what Dynamic Health Center stands for in our practice and in our consultation. Homeopathy, as I mentioned before, Hahnemann stated in the Organon, the physician's highest calling, his only calling, is to make the sick people healthy, to heal. The highest ideal of therapy is to restore health rapidly, gently, permanently, to remove and destroy the whole disease in the shortest, surest, least harmful way according to the clearly comprehensible principles quoted from Organon paragraph 1 of homeopathy. And with that I conclude the first talk.
I'm Dr. Suma Omen and I'm an internal medicine physician, and I'm so glad all of you could make it on this Saturday morning when most people don't want to be in a seminar. I'm really grateful that all of you are here. And this is the first symposium of our HMAA, and we think it's a very good opportunity that we have, and we once again want to welcome you all. I practice internal medicine physician right with my husband in Dynamic Health Center. But I'm very interested in homeopathy, and it's my goal to advocate homeopathy, especially to the medical community who knows so less about it. Hippocrates, you have all heard about. Every medical doctor has heard about it, because when we enter medical school, we have to take an oath called the Oath of Hippocrates. Most of us don't remember what it is ever again in our life, but we still have to go through the motion of saying it. And again, Hippocrates is he's known as the father of modern medicine. He's an ancient Greek physician of the age of Pericles. I don't know what that means, but it was just mentioned there. And he's one of the most outstanding figures in the history of medicine. He lived in a time and era when not much was known about health and medicine. And there were a lot of practitioners who were doing a lot of odd stuff, just like Dr. Omen was mentioning, bloodletting, leeches, all those different stuff. And he was one of those people who was very reluctant to administer drugs. And he refused to engage in something that he wasn't sure about. He did very generalized treatments for very generalized diagnosis. But the one thing I like about the oath that we take, one of the main emphasis is first do no harm. And that's a very important part of the oath that many of us, all of us medical physicians have to take.